we're on a roll with our medication, so let's talk about Levalbuterol, also known by its brand name, which is Xopenex, with an X, not a Z, like xylophone. Xopenex. One of the first things that I ask my students when I'm introducing this medication is, what do you notice about this med? And usually they'll say albuterol is in the name. And albuterol is a very common beta-2 agonist, and most people, even from the general public, know what albuterol is from maybe being prescribed an inhaler when they were sick or if they had asthma or something like that. Yes, albuterol is in the name Levalbuterol. It is not the same medication, but it is in the same drug class. So Levalbuterol is a beta-2 agonist and a bronchodilator. So what's our indication, or why would we give Levalbuterol? Well, pretty much for the same reason that we would give albuterol, which tends to be wheezing associated with COPD. And COPD is kind of that umbrella term, right, for three conditions: chronic bronchitis, emphysema, and asthma. Oftentimes, though, whenever someone says they have COPD, they're usually not referring to asthma or chronic bronchitis. They're usually referring to emphysema. And Levalbuterol can be used in the case of anaphylaxis as well. So let's talk mechanism of action, or how it works in the body. So Levalbuterol goes in and it agonizes those beta-2 receptors. Remember the difference between beta-1, beta-2? We've got two lungs, one heart. It agonizes those beta-2 receptors, and by doing this, it induces smooth muscle relaxation and bronchodilation. But surprisingly, not a lot of departments and EMS services carry Levalbuterol. It tends to be pretty expensive, and most services will just go with albuterol as their beta-2 agonist. So some contraindications of Levalbuterol are going to be a peanut or soy allergy, and then also severe tachydysrhythmias that are secondary to severe cardiac conditions. As always, before we get into dosages, make sure you're abiding by your local protocol, staying within your scope of practice. But a typical adult dose of Levalbuterol is going to be 1.25 milligrams in 3 ml. So they come in little bullets, very similar to albuterol. And it would just be placed in the SVN and given over 5 to 15 minutes. As for a pediatric dose, it's 0.63 to 1.25 milligrams in a 3 ml solution. And some adverse reactions of Levalbuterol can include throat irritation, coughing, anxiety, and sometimes tachycardia, although it isn't as common with Levalbuterol as it is with albuterol. And when we talk about drug interactions, we have to remember that if a patient is on a beta blocker, and remember beta blockers end in LOL, it may dull the effects of Levalbuterol because Levalbuterol is a beta-2 agonist, and a beta blocker is going to block those receptors, right? So it may actually take more of the medication to achieve the desired effect. And a side note about Levalbuterol: whenever myocardial demand or stress is a concern for our patient, maybe they have some severe cardiac issue, Levalbuterol is usually ideal in those situations because it doesn't quite have the tachycardic effects that albuterol does.